floor is yours. Thank you.
Thank you, Madam Chair. Good afternoon. Civil society is not a homogeneous and does not encompass a singular view. However, we as civil society representatives and advocates come together around a shared interest and purpose to advocate for a community-led approach to halt the spread of the COVID-19 infodemic. Though we are a diverse group, we share similar challenges when it comes to infodemic management within our respective communities. Today, I will present 3 challenges which we believe must be addressed in order to manage the COVID-19 infodemic and mitigate its re-emergence in future pandemics. 1, a lack of timely, accessible, credible, verifiable, and contextualized information in a variety of languages and formats from local, regional, global actors make it difficult for factual information to reach intended audiences and creates opportunities for disinformation, misinformation, and malinformation to thrive. 2, mistrust in government and global health agency is pervasive and proliferating due to uncoordinated and at times misleading or even false information. 3, low health, digital media and information literacy and capacities make it difficult to access and reach our intended audience. Technical and inaccessible language makes it difficult for broad audiences to understand the information that is being shared with them. These challenges affect us all. People around the globe are eager to halt the spread of COVID-19. There are many, however, that are uncertain, concerned, afraid, and mistrustful. They want to end the pandemic, but may struggle to find actionable information relevant to their lives and context. So we wish to propose the following solution and ask today. 1, by investing and supporting and leveraging existing community-based structures, including local media, we can advance the agency and ownership of communities through the co-creation and co-development of solutions. This process ensures credible, verified, and actionable information is accessible and contextualized with the need, perspectives, experiences, and realities of all actors in the information ecosystem. We ask that multilateral organizations should support and build the capacity and agency of community-based structures so that communities are able to meaningfully engage in decision-making, governance, and program development. This entails active and continuous engagement, mainstreaming, sponsorship, and resource based on the principles of trust, consent, accessibility, justice, and open science. 2, in order to address these drivers of disinformation and misinformation, we must hold governments and other authoritative bodies accountable to the communities they serve. We must shift words into action and foster trust and continued dialogue between communities and relevant stakeholders with the ultimate goal of ensuring that communities are at the center of decision-making processes. We ask that government agencies and multilateral organizations must be held accountable and adopt an inclusive, intersectional, responsive, transparent, and community-driven approach to rebuild trust. Funding needs to be transparent and responsive to the communities they are meant to serve and include accountability and oversight mechanisms to ensure impact for the community. And 3, literacy is not simply an issue of being able to read and write. Comprehensive literacy entails critical thinking and analysis, including the ability to discern fact from fiction. Advancing literacy requires us to understand key barriers to access to information and services, including healthcare. We ask that governments and multilateral organizations must invest in transliteracy, ensuring that diverse communities have the resources and skills necessary to access, understand, and critically analyze, assess, and information, especially as it relates to their health and well-being. Additionally, media organizations and practitioners need to be more inclusive and equitable, reflecting the diverse identities and experiences of communities they are working in and reporting on. And our last ask, scientific and public health communities should make efforts to translate complex health and other technical concepts into relevant and accessible content that uses familiar terms and languages. Difficult challenges require innovative and robust solutions, but most important, they require the will and desire to change. What we have presented here requires a global shift from top-down to bottom-up approaches to community-led problem-solving and decision-making. Until we meaningfully shift how we view, engage, and support communities across the globe, mainstreaming their role in response efforts, we will continue to face the core drivers of the infodemic. Thank you.
Thank you very much, Praveen Gomez.